Hey guys, how you doing? I'm not a doctor, but I'm playing one in this video. This video is all about Hashimoto's awareness. I have it, and you or a loved one may also have it. Hashimoto's disease is a condition in which your immune system attacks your thyroid. The thyroid gland is part of your endocrine system, which produces hormones that coordinate many of your body's functions. Inflammation from Hashimoto's disease, also known as chronic lymphocytic thyroiditis, often leads to an underactive thyroid gland called hypothyroidism. Hashimoto's disease is the most common cause of hypothyroidism in the United States. It primarily affects middle-aged women, but also can occur in men and women of any age and even in children. Just because you might have a low thyroid doesn't mean you automatically have Hashimoto's. But if you do have Hashimoto's, you do have a low thyroid. Some signs and symptoms of hypothyroidism include fatigue and sluggishness, increased sensitivity to cold, constipation, pale and dry skin, a puffy face, brittle nails that break or peel, hair loss, enlargement of the tongue, unexplained weight gain, muscle aches, tenderness and stiffness and muscle cramps, joint pain and stiffness and swelling, muscle weakness, excessive or prolonged menstrual cycles, depression, and memory lapses. And there are many more on this list, not listed here. Why a butterfly shape, you ask? Because the blue butterfly is the symbol for Hashimoto's awareness. I even have one tattooed on my arm. Anyway, Hashimoto's disease is an autoimmune disorder in which your immune system creates antibodies that damage your thyroid gland. These antibodies attack your thyroid gland, causing it to swell, and it could cause a goiter. Eventually, it could actually kill the thyroid gland altogether, requiring surgery to remove it, and also requiring you to be on artificial synthetic thyroid gland medication for the rest of your life, mainly name brand called Synthroid. These risk factors may contribute to your risk of developing Hashimoto's disease. If you're a woman, if you are middle-aged, you are at a higher risk for developing Hashimoto's disease if others in your family have thyroid or other autoimmune diseases. Having another autoimmune disease, like rheumatoid arthritis, type 1 diabetes, or lupus, may increase your risk of developing Hashimoto's disease. Also, people exposed to excessive levels of radiation or environmental radiation are more prone to Hashimoto's disease. Hashimoto's can lead to the following problems if left untreated. You may get a goiter. It's a growth on your thyroid gland from swelling because your body is attacking it. It can be as small as a pea or as big as a tennis ball. If left untreated, hypothyroidism can also lead to an enlarged heart and possibly heart failure. Also, depression may occur in Hashimoto's patients and become more severe over time. Hashimoto's disease can also lower the libido and lead to slow mental functioning. If left untreated, Hashimoto's can cause myxedema, which is a life-threatening condition from drowsiness that leads to unconsciousness and eventually a coma. Babies born to women with untreated hypothyroidism and Hashimoto's disease have a higher risk of birth defects. These children are more prone to intellectual and developmental problems. There may also be a link between hypothyroid pregnancies, birth defects, and cleft palate. A connection also exists between hypothyroid pregnancies and heart, brain, and kidney problems in infants. If you're planning to get pregnant, please have your thyroid levels checked. Really, it's just one simple blood test, just to check your TSH. That's your thyroid stimulating hormone. And if they want to check for an autoimmune disease like Hashimoto's, they would check your ANA. That's your anti-nuclear antibodies. Those are those little guys that like to attack you. And always remember, whenever you're looking for medical advice on the internet or on Google, Don't fall for the woo. Always look for reputable sources. Don't fall for a thyroid pharmacist or any other practitioner that is not an endocrinologist. Always stick to sources like the Mayo Clinic, the Cleveland Clinic, or the NIH. Thank you for coming by for today's discussion about Hashimoto's autoimmune lymphocytic thyroiditis. Always remember to forge your own path. And wear Crocs a lot. Remember, I'm not a doctor, I just play one in this video. Stay healthy out there.